Welcome to the Reimagine Healthcare podcast. I'm your host, Noah Voles. I'm doing something a little different today. I want to tell you about a family in Medford, teacher and a construction worker, 2 kids. They're earning $64,000 a year, right around the median for Southern Oregon. They're not struggling. They're doing okay. They have health insurance through the construction company. They pay $640 a month for it. That's $7,680 a year just in premiums. Before they see a doctor, even once, their deductible is $7,500. Now let me walk you through their year, because this is where you'll see the problem. January. One parent's chronic neck pain flares up. It's been an issue for a while, but this time it's bad. Can't sleep. Hard to do overhead work. Should see a doctor, right? Get some muscle relaxers, maybe some physical therapy. Total cost is probably $1,200. And remember, their deductible is $7,500. So insurance pays exactly $0 until they hit that number. They think, it's January. We haven't touched the deductible. If I spend that money now, we're still far away from insurance helping at all, and we've got 11 more months to go. So they wait, take some ibuprofen, hope it gets better. April. One of the kids starts having breathing problems, wheezing, trouble keeping up in PE class. The school nurse thinks it might be asthma. Should see the pediatrician. Probably need an inhaler. Cost could be $900 out of pocket. They still haven't hit the deductible. They've got last year's rescue inhaler in the medicine cabinet. They'll just use that and see if it gets better. July. Free health screening at work. The other parent's blood pressure is high, 148/94. The screening nurse says, "You should see your doctor about this." The screening is free. Many commercial health plans cover preventive screenings and well checks, but when it is a new symptom, it goes towards the deductible. Estimated cost is $600 for the visit and mediation, but the deductible still hasn't been touched. And they're thinking, it's just high blood pressure. I'll watch my diet, exercise more. October. The kid's asthma is much worse now. They're wheezing constantly. School calls. The kid can't breathe well. They have to go to the emergency room. That ER visit, $2,400. November. The parent with neck pain can't wait anymore. It's affecting work. The boss has noticed. They finally see the specialist, get the MRI, start physical therapy. Cost, $3,780. December. The parent with high blood pressure has chest pain, scary chest pain. They go to the ER. Turns out it's anxiety, not a heart attack, but of course they didn't know that. ER visit, $2,800. Then follow-up appointments reveal the blood pressure is dangerously high, 168/102 now. And prediabetes. They start medications they should have started in July. Let's add it up. Healthcare cost for the year, $9,680. The family's out of pocket. They paid $7,680 in premiums. Then, the first $7,500 goes to the deductible. Then there's another $654 in coinsurance. That's the 20% they pay even after hitting the deductible. Total out of pocket, $15,834. They earn $64,000. They spent $15,834 on healthcare. That's 25% of everything they earn. And you know what's worse? Most of this was preventable. If they could have afforded the early care, the orthopedist in January, the asthma care in April, the blood pressure medication in July, they wouldn't have needed the emergency room visits. The neck pain wouldn't have gotten so severe. The blood pressure would have been controlled months earlier. But with the high deductible, they decided they couldn't afford it. So they ended up paying for the expensive stuff. And now they're carrying $6,200 in medical debt on credit cards at 18.9% interest. This family has insurance. They pay for insurance every single month, and it didn't help. This is what we call underinsurance. You have insurance, but your insurance is so inadequate that you can't actually use it when you need it. Here's the simple definition. You're underinsured if your deductible is more than 5% of what you earn in a year, or if you spent more than 10% of your income on healthcare costs last year, even with insurance. That Medford family, their deductible is 12% of their income. They spent 25% of their income on healthcare. They're deeply underinsured, and they're not alone. In Southern Oregon, 42% of people with commercial insurance are underinsured. 42%. That's 13,500 families. About 24,000 people total. Let me put that in perspective. If we had a disease that affected 42% of insured people in our region, we'd call it an epidemic. We'd declare a public health emergency. But when it's insurance that doesn't work, we call it having skin in the game or consumer-driven healthcare and act like it's working as designed. Now, underinsurance is a national problem, but it's significantly worse in Southern Oregon than most places. National average, 29% of commercially insured people are underinsured. Portland, 31%. Eugene, 35%. Southern Oregon, 42%. We're much higher than the national average. Why? First, our deductibles are higher relative to what people earn. Median household income in Southern Oregon, $57,400. That's 21% below Portland. But the average family deductible here, $7,800. That's actually 3% higher than Portland. So we earn less and pay more. The deductible takes up a much bigger chunk of income. Second, we're older. Median age here is 43 compared to 40 statewide. Older people need more health care. That means we're more likely to actually hit those deductibles. Third, we have fewer plan options. Only 4 insurance carriers in the small employer market. 2 of them control 78% of the market. Less competition means less pressure to offer affordable plans. It's getting worse fast. In 2015, 28% of commercially insured people here were underinsured. Today, it's 42%. That's a 50% increase in 10 years. Deductibles have gone up 86% in that time, from $4,200 to $7,800. Incomes up only 11%. Deductibles are growing almost 8 times faster than what people earn. The math doesn't work. Now let me tell you about one of the most insane parts of this whole system. It's called the affordability cliff. Here's how it works. You've got a family of 4 earning $57,720 a year. That qualifies them for the Oregon Health Plan, basically Medicaid. Their health care costs are maybe $50 a month, sometimes nothing. Good coverage. Now imagine they get a raise, or one spouse picks up some extra hours. Their income goes up to $61,500. That's $3,780 more, a 6.5% raise. But now they no longer qualify for the Oregon Health Plan. They have to buy insurance on the marketplace. Even with subsidies, they're now paying $420 a month in premiums with a $6,500 deductible. Their total annual healthcare costs go from basically nothing to $11,540. They earned $3,780 more. Their healthcare costs went up $10,940. They are now $7,160 worse off than before the raise. Let me say that again. A $3,780 raise made them $7,160 poorer. This creates completely insane incentives. The rational thing to do is refuse overtime, turn down raises, have a spouse quit working. I know a nurse making $58,000 base salary. With overtime, she could make $62,000, but that extra $4,000 would push her off the Oregon health plan and onto insurance that costs $11,200 a year. She'd be worse off working overtime. So she doesn't. And the hospital has staffing shortages. This is happening all over Southern Oregon. People trapped between earning too much for help and not earning enough to afford the help they're not getting. So what happens when people have insurance but can't afford to use it? The theory behind high deductible plans was that people would become better shoppers for healthcare. You've got skin in the game, so you'll be more careful about what care you get. Here's what actually happens. People avoid all care, not just unnecessary care. There was this big research study that looked at what happens when you make people pay more out of pocket. Low-value care, stuff you probably don't need, dropped by 8%. But high-value care, stuff you absolutely do need, dropped by 22%. Preventive care dropped by 28%. Chronic disease management dropped by 31%. People don't distinguish between necessary and unnecessary care. They distinguish between affordable and unaffordable. We see this in Southern Oregon all the time. Compare people with deductibles under $3,000 to people with deductibles over $6,000. The people with the larger deductible decrease there. Preventive visits and chronic disease follow us by over 30%. They decrease their use of medications for chronic conditions and seeing specialists when referred by over 40%. But you know what goes up? Emergency room visits and hospitalizations. See what's happening? In the first year, high deductibles save about $1,800 per person. Sounds good, right? But in years 2 and 3, costs go up by $4,200 per person because of complications from delayed care. We're not saving money, we're just spending it later. That Medford family we started with? Perfect example. They delayed asthma care, delayed blood pressure medication, delayed neck pain treatment, and ended up spending way more on emergency care and treating complications. Now, here's something most employers don't realize. Let's say you're a business with 100 employees. You're paying maybe $1.7 million a year in health insurance premiums. That's the number you see on your invoice. But what about the costs you don't see? When employees can't afford to see the doctor, they get sicker. They miss more work. That's about $95,000 a year in lost productivity. When people come to work sick because they can't afford treatment, what's called presenteeism, that's another $73,000 in reduced productivity. When 18% of people who quit cite healthcare costs as a reason, and you have to recruit and train replacements, that's $154,000. Workers' comp claims that could have been prevented with earlier treatment, $42,000. Add it all up, and you're paying about $404,000 a year in hidden costs because your employees can't afford to use their insurance, on top of the $1.7 million in premiums you already pay. Total healthcare related cost, over $2.1 million. That's $21,400 per employee. Now here's the thing. If you reduce the deductible from $7,200 to $3,500, your premium costs would go up by about $220,000. But those hidden costs, they drop by $184,000. Net cost increase, only $36,000. And you'd have healthier, more productive employees who stick around longer. Most employers see positive return on investment within 18 to 24 months. But they don't do it because they don't see those hidden costs. They only see the premium number. Now, zoom out to the whole region. We've got 13,500 underinsured people here. Each one is generating about $4,800 a year in excess costs from delayed care, preventable ER visits, and complications. That's $65 million in direct waste annually. But then you add the ripple effects, lost work days, people too stressed about healthcare bills to spend money in the local economy, businesses losing good employees over healthcare costs. Total impact, about $185 million every year. To put that in perspective, that's enough to build 620 affordable housing units annually, or hire 1,850 additional teachers, or repair 370 miles of roads, or help 740 small businesses get started. We're just burning that money because insurance doesn't work. And it creates this vicious cycle that makes everything worse. When people avoid care, they eventually get sicker and need expensive treatment. Insurance claims go up, so premiums have to go up. To keep premiums from going up too much, insurers raise deductibles. Higher deductibles make people avoid more care, which makes them sicker, which raises claims, which raises premiums, which raises deductibles. It feeds on itself. Look what's happened in Southern Oregon. Healthy people are dropping coverage because it's too expensive. In 2015, 87% of eligible employees took the insurance. Today, it's 76%. When healthy people drop out, the people who stay are sicker on average. Sicker people cost more, so premiums go up faster. Average family premium in 2015, $19,200. Today, $31,200. That's a 62% increase. This is the early stage of what insurance people call a death spiral. It's not critical yet, but that's the direction we're headed. So people say, well, if your deductible is too high, just get a plan with a lower deductible. And I get why that sounds reasonable. But here's the problem. For most people in Southern Oregon, that choice doesn't exist. First, we only have 4 insurance carriers here. 2 of them control 78% of the market. If you work for a small company, you get whatever plan your employer picks. You can't just choose something else. Second, look at what's actually available. Of all the small employer plans offered in Southern Oregon, only 18% have deductibles under $5,000. 42% have deductibles between $7,000 and $9,000. 22% have deductibles over $9,000. The typical plan has a $7,800 deductible. That's not the worst plan, that's the average. And even when lower deductible plans exist, here's the trade-off. High deductible plan, $497 a month, $8,000 deductible. If you use healthcare, total potential cost, $13,964. Lower deductible plan, $672 a month, $3,500 deductible. If you use healthcare, total potential cost, $11,564. For a family earning $62,000, the high deductible plan is 22% of gross income. The low deductible plan is 18%. Both are unaffordable. You're just choosing which way to be screwed. So people get creative, they try to find workarounds. Some join health sharing ministries, not actually insurance, no guarantee they'll pay, lots of exclusions. We covered those in a previous episode. Some go to cash pay clinics for specific things. You can get an MRI for $650 cash instead of $2,800 through insurance. But that only works if you're planning it. Doesn't help with emergencies. Some travel to Mexico for dental work and prescriptions. Huge savings, but quality varies, and there's no recourse if something goes wrong. Some use direct primary care for basic stuff. That's great for primary care, but you're completely exposed for the other 85% of healthcare costs: specialists, hospitals, imaging, prescriptions. And the most common workaround? Just avoiding care entirely. 6,000 to 8,000 underinsured people in Southern Oregon do this every year. It saves money in the short term, but when you finally can't put it off anymore, it's way more expensive. And sometimes it's too late. All right, so what do we do about this? Let me give you solutions that are actually proven to work. Solution 1. Employers redesign benefits, lower the deductible, accept slightly higher premiums, but calculate the full return on investment, including reduced turnover, better productivity, fewer sick days. Some employers here have done this. They've seen positive returns within 2 years because the hidden savings offset the premium increase. Solution 2. Employer purchasing coalitions. Multiple small employers band together to negotiate as one big group. Share risk across a larger pool. Get better rates. This works. Colorado did it. Indiana did it. They're seeing 12 to 18% cost reductions sustained over multiple years. We're building one right now in Southern Oregon called the Oregon Health Business Alliance, OHBA. If you're an employer, get in touch with Maggie Sullivan to be a part of the recruitment and data gathering phase. Solution 3. Integrated direct primary care. Not DPC alone, but DPC plus modified insurance that carves out primary care costs and lowers the deductible for everything else. When you do this right, total costs drop by 10 to 15%, and people can actually see their doctor when they need to. Solution 4. State subsidies for middle-income families. Right now, if you earn between $62,000 and $150,000, you get minimal or no help from federal subsidies. A state program could fill that gap. Colorado has done this. Washington is doing it. Oregon could do it. Solution 5. Reference-based pricing. Instead of letting hospitals charge whatever they want, employers set maximum payments based on what Medicare pays, plus a reasonable margin. This can save 12 to 18% on hospital costs. Montana did this. It works. None of these are theoretical. They're all proven. The evidence is clear. Let me show you what these solutions look like for that Medford family. Scenario A, status quo. What they experienced: $7,680 in premiums, $7,500 deductible. They delay care. Kid ends up in the ER twice. Parents' neck pain gets severe before treatment. Blood pressure uncontrolled for months. Total out of pocket $15,834. And they're carrying $6,200 in medical debt. Scenario B, lower deductible plan. Premiums go up to $8,640, but deductible drops to $3,500. Now they can afford to get care when they need it. Kid sees the pediatrician in April, asthma controlled, no ER visits. Parent gets neck pain treated early, blood pressure controlled from July. Total out of pocket, $12,352. Saves $3,482 compared to status quo, and way better health outcomes. No medical debt. Scenario C, integrated direct primary care through coalition. Employer pays for DPC membership, unlimited primary care at no cost, modified insurance with lower premiums and lower deductible. Kid with asthma? Same day DPC appointment in April. Controller inhaler started immediately. Monthly check-ins to optimize. No ER visits. Parent with neck pain? Weekly DPC visits during recovery. All included. Parent with high blood pressure? Caught at July screening. Medication started same week. Weekly monitoring through DPC. No ER visit. Total out of pocket, $9,273. Saves $6,561 compared to status quo. Superior health outcomes, zero financial stress, no medical debt. Over 3 years, status quo cost them $52,434, and their health is declining. Lower deductible costs $39,252 with good health outcomes. Integrated DPC costs $29,023 with excellent health outcomes. That's a $23,411 difference over 3 years. Here's what I need you to understand. Southern Oregon has worked really hard to expand insurance coverage over the past decade. That work matters. Being uninsured is worse than being underinsured. But coverage alone is not enough. When 42% of people with insurance still can't afford to use it, when they're choosing between healthcare and rent, when they're delaying care until it becomes a crisis, when they're carrying medical debt despite paying premiums every month, the system has failed. This is not a personal failure. This is a system failure, and it's solvable. We've got the tools, we know what works: employer coalitions, benefit redesign, integrated care models, state subsidies, reference-based pricing. The question is whether we're willing to coordinate, because no single employer can solve this alone. No individual family can fix this alone. No provider can change this alone. No policymaker can mandate this alone. But coordinated action across employers, policymakers, providers, and community leaders can transform Southern Oregon's healthcare affordability within 18 to 24 months. We can keep going the way we're going. Underinsurance gets worse, the economic damage accelerates, more people leave, medical debt increases, or we can coordinate, build employer coalitions, redesign benefits, integrate care models, advocate for state support. We can reduce underinsurance from 42% to under 20%. Keep $110 to $140 million in our regional economy. Stabilize our workforce. Improve health outcomes. Insurance should reduce fear, not create it. When coverage provides real financial protection, when it enables timely care instead of forcing impossible trade-offs, when it supports health instead of threatening economic security, that's when the system works. We can build that system in Southern Oregon. Thanks for listening. This podcast is for educational purposes only, not medical advice. I might get details wrong. If you catch errors or have alternative perspectives, please comment. If you want to go deeper into this topic, subscribe to our newsletter at reimagine-healthcare.org. Thanks for listening.